Good morning, everyone. Welcome to Grand Rounds at the UCSF Osher Center for Integrative Health. My name is Shelley Adler, and I have the pleasure of serving as the director of the Osher Center. And today I am delighted to introduce Dr. Emmeline Edwards, our special guest. Dr. Edwards is the director of the Division of Extramural Research of the National Center for Complementary and Integrative Health, known to many of us as NCCIH. Where she's responsible for the development of scientific programs, as well as planning, implementation, and policy. Before joining NCCIH, Dr. Edwards served as Deputy Director of the Extramural Program at the National Institute of Neurological Disorders and Stroke. Dr. Edwards earned her PhD in neurochemistry from Fordham University, completed postdoctoral research in behavioral pharmacology and neuroscience at the State University of New York. And I was also an associate professor in the Department of Pharmacology at the University of Maryland, where her research focused on neural mechanisms of complex behaviors and characterization of a genetic model of affective disorders. Dr. Edwards currently serves as the chair of Women in World Neuroscience, an independent mentoring and networking organization that provides opportunities for women neuroscientists across the world. Now, a moment of housekeeping. After Dr. Edwards' presentation, we'll have about 15 minutes for discussion. So the best way, well, there are two different ways to share your questions. One is to submit them to me by way of the chat feature. I always suggest sending them at any time during the presentation, so you don't have to remember what your question is. And then you'll also have the opportunity to pose questions directly to Dr. Edwards during the discussion. So either one of those will be perfect. Finally, I want to thank our Grand Rounds Planning Committee, Drs. Anand Dhruva, Selena Chan, and Sarah Patterson, and soon adding Dr. Patricia Moran. Please join me now in welcoming our wonderful speaker, Dr. Emmeline Edwards. Thank you so much for joining us this morning, Dr. Edwards.
Thank you. Thank you so much for the invitation. I'm delighted to join you at, and give Grand Round at the Osher Center for Integrative Health. So this is a real pleasure. I am going to share my slides. Hold on. Okay, can you see my slides?
Yes.
I'm going to put them on presenter view.
Okay, yes, I was just going to say.
Okay, is that okay now?
Yes, perfect.
Okay, so again, I'm very pleased to be here today. I'm going to tell you about a story about building the evidence-based research for arts and health. And first, I have, as a federal employee, I need to put this disclosure file telling you that I have no conflict of interest. So today I'm going to tell you a bit about the Sound Health Initiative, but I'm also going to broaden the topic into other health initiatives that look at different art forms other than music. So we have music in the brain. We also have the NeuroArts blueprint, the Epi Arts Lab, and the Sound Health Network, which is housed at UCSF. And then I'll tie it together with what we're doing at NCCIH in terms of art-based therapy, which we consider as mind and body approaches, and then put it all together into the context of whole person health. So I love that slide because it actually, shows the very beginning of this entire adventure that we've been on at the NIH in the context of looking at the potential impact of the arts on health. So this slide is the former NIH director, Dr. Collins, and of course, Renee Fleming, a renowned soprano singer. And most of you, or some of you might have heard this story, but this all started in a very unusual way. Dr. Collins and Renee were, at a dinner party at former, Justice Scalia a while back in 2016. and were seated next to each other, and the conversation was getting a little bit tense because they were discussing, same-sex marriages, and they decided to actually break into a song. And Dr. Collins is the musician, and so is Renee. So they started, singing together, and then further had conversation about how interesting it would be if actually we could engage into doing more research at the NIH in the context of music. And so this is how the Sound Health Initiative was born. So this is, at the time, Renee Fleming was the artist in residence at the Kennedy Center. So this collaboration started between the NIH, the Kennedy Center, and we were later joined by the National Endowment for the Arts. And so the whole initiative, the goal was to increase our understanding of how music could impact health, with an emphasis on the basic neuroscience of music and the potential clinical application. So from the very beginning, we were interested in bringing neuroscientists together with music therapists and investigators that were focused on development of interventions. So in 2017, we actually had a workshop at the NIH that was focused on music and the brain and looking at research across the lifespan. One of the unique features of that workshop was, this was probably one of the first opportunities that we had to systematically bring together basic and clinical researchers with music therapists and music professionals, as well as organizations that were involved in the arts. So we had a panel of experts from the US, Canada, and Europe, and their expertise spanned from basic neuroscience of music to music therapy to clinical trial methodology. We actually, a year later, we published the summary of that workshop and a set of recommendations in Neuron. And this was really our first step in starting to generate more excitement into the development of a research field for music and health. The recommendation really spanned 4 major areas: basic and mechanistic research, translational and clinical research, methods and outcome, and capacity building and infrastructure. Up to that point, NIH had a smattering of grants that were in this area, but really a very, very small portfolio in the context of basic research on music and health, and very few, clinical trials. Once we had, a set of recommendations, the former NIH director, Dr. Collins, decided to present this information to the institute directors of the 27 institute at the NIH. He really wanted to form a trans-NIH working group that would really develop this area of science. And so after he made this plea to the IC directors, we actually got representation from 20 of the institute out of the 27. And the charge given to that working group by Dr. Collins was to not only develop, but also to implement a research agenda that would include both basic and applied research, and that the agenda should be very mindful in including partnership between musician, clinician, and scientists. We have 3 co-chairs of this NIH working group. I'm one of those co-chairs, and I'm joined by Bob Fickelstein at the Neurology Institute and Tom Shiver, also now at NINDS. Previously, he was at the NIAMS Institute. before I go on, I just wanted to give you a couple of examples of, to make the point that there is in fact a premise to encourage further development of the work on music and health. On the right-hand side of the slide, this is work from animal work from using the marmoset monkey. A group at Johns Hopkins actually identified a very specific set of neurons that are responsive to some characteristic of music, such as pitch and harmonic structure. So that gives you some idea of the specificity of the impact of music in the auditory cortex. On the human side, on the left-hand side, this is work by Bob Zatorre at McGill University. He and his group really established the neural correlates of music by doing some imaging studies that actually demonstrated that the music is processed primarily in the auditory cortex, but the auditory cortex is not, existing in an island on its own. So there is a lot of connection between the auditory cortex with the prefrontal cortex and the ventral premotor cortex and other areas of the brain. Zatorre and his group further did some studies that actually demonstrated a very nice connection between the auditory cortex and the limbic and autonomic circuit. So using PET imaging, they demonstrated that once you're listening to music, you actually activate areas of the brain that are related to the reward and the emotional system. They also demonstrated that when you listen to music that's pleasurable, you have an increase in dopamine release, and also some activation in the areas of the reward system as well. What we don't know is how those music neurons in the auditory cortex, how are they connected to neurons in the ventral striatum, in the midbrain? We don't know that. So those are areas of intense activity in terms of research that's ongoing. But there are opportunities now to actually better understand those interconnected neural circuits and how they actually interact when we are either listening to music or producing music. This is work by Stephen Koch in Norway, where he actually, again, showed the interaction of the auditory cortex with a number of other systems, the motor system, the autonomic system, and the vestibular pathway. And I put this slide here to actually highlight the potential of actually doing work that will overlay this circuitry with the neural correlates of addiction, the neural correlates of pain, and also some nervous system disorders that are related to stress. All of those areas of extreme importance, and definitely encourage research in those areas. Remember those recommendations that we got from the Neuron paper in terms of the basic and mechanistic and translational and clinical research. What NIH did to actually address some of those recommendations was to develop some funding opportunity announcement. So in 2019, we actually had 3 different requests for application. We did have a set aside pot of money that was obtained by receiving contribution from the various NIH institutes. And 2 of those RFAs were focused on the fundamental aspect of fundamental science of music and the brain. And one of them was focused on phase innovation research to encourage development of better music intervention. So out of those RFAs, we actually funded 15 grants in FY19 with over $5 million per year in awards. We later on reissued those same, RFAs, but this time there was no set aside, but institutes indicated interest in contributing to paying those applications. So we actually have two opportunities open. One, actually three. We have the R1 and R21, Music and Health, Understanding and Developing Music Medicine. And we also have a reissue of the PhD award focused on music intervention. We only have awarded 3 grants in FY21 as a result of this reissue, but we still have plenty of opportunity to increase the pool of investigators. Yeah. I just want to give you a couple of examples of the type of research that has been funded so far. So we can break them down into 3 major categories. A lot of researchers are looking at the impact of music on early development. Some are looking at the impact of music and how the auditory, motor, and cognitive circuits interact. And then some researchers are primarily focused on the potential of using music as a healing intervention. When we look at the first round of applications that we got from the RFA and did some data mining of the title, the abstract, and the specific aim, essentially it was pretty well distributed. We got lots of music therapy, some work in the prefrontal cortex, some animal model work, some characterization of various aspects of music, such as rhythm. And that was spread across various career stage of investigators. If we look at it in the context of disease, we got lots of interest in pain, cancer, mental disorders, cognitive impairment, and neurodegenerative disorders. Just to give you 3 specific examples of some of the Music and Health Awards. The first award is from the Phase Innovation Award. This was actually submitted by Gammon Earhart at Washington University. And she is working with Parkinson's patients. And a lot of work had been done in terms of improving the gait of Parkinson's patients with music. But her work was very unique in the sense that she was also examining the potential of using self-generated rhythmic cues. So just imagining the music would have an impact on gait. And she published some of that work in 2020. Another example from John Iverson is actually looking at the impact of music on brain and behavioral development. John did a very interesting, had an interesting approach. He actually utilized the ongoing ABCD study that the National Institute of Drug Abuse has spearheaded. So it's a large set of, he has a large scale nested set of studies that he's actually leveraging to carry out those experiments. And just recently published a very nice paper in 2022 in the Journal of Neuroscience. And then finally, another example is the work of Mimi Kao and Annie Patel at Tufts University, where they're actually using an animal model to study the auditory motor interaction during rhythm perception. Again, they just published a lovely paper at in PNAS at the end of 2021. I encourage you to take a look at those papers. In addition to the work that we're funding through RFAs or a specific program announcement with special review criteria, we also have investigator-initiated applications. And Not that many, but they do exist. So from 2018 to 2020, we had about 22 awards that were from investigator-initiated applications, and they are utilizing various mechanisms. So for example, we have a grant that's funded by the Deafness and Communication Disorder Institute that's looking at pitch perception in complex environments. We have a grant that funded by NIMH that was looking at music as a therapy for social anxiety disorders. And also the Aging Institute funded a postdoctoral fellowship looking at a tailored music intervention to reduce sleep disruption in older adults with dementia. So this is just to give you a range of the topics and the various institutes that are funding those awards. So my message is that we continue to be interested in music and health, and we want you to send us your grant application. I say this because when Dr. Collins stepped down as NIH director, there was, I received many emails from many investigators asking whether or not we were going to continue the focus on music and health at the NIH. And I want to reassure you that we do intend to continue this program. Dr. Collins is now a researcher at the Genome Institute, but he continues to be very involved and is still in the steering committee of the Sound Health Initiative. So I want to again emphasize, please send us your grant application. We have funding announcements that are currently open. We have for the R61, R33, which is the Phase Innovation Award focused on music intervention. The next receipt date is June 2nd of this year, but we also have other receipt dates in 2020, in October and also in 2023. For the basic science grant, the next receipt date will be in February of 2023. So you have one more chance to apply, and we certainly encourage you to do so because we do want to increase the portfolio and enlarge the pool of investigators that are actually doing this kind of work. Just going back to those recommendations that we highlighted in the Neuron paper. Moving to methods and outcome, the next step for us was really to take a step back and really take and assess the quality of the work that's in the literature in the context of music intervention. And we realized that it might be helpful to actually to enhance the rigor and the reproducibility of those, of that work, to actually develop a toolkit for investigators that would be engaged in music, based intervention. So last year, while we were all at home during the pandemic, we actually held a series of virtual meetings in 2021, in March, in June, and in August of 2021. This was a project that we are currently, we have a manuscript under review at Lancet Neurology that will actually detail what we actually covered in those 3 workshops. But to give you a sense of the goal of this project, this was a collaboration between the National Institute of Health and the Foundation for the NIH. The Foundation for the NIH is, it's really a public-private partnership. While NIH staff cannot actually lobby and request funding from various organizations, the Foundation from the NIH can. And so we partnered with them to develop this evidence-based toolkit for music therapies. We chose to focus on brain disorders of aging for now as a first step, but the work that we're developing for this particular focus, we intend to extend to other conditions. So the project was funded by NIH, the Foundation of the NIH, and the Renee Fleming Foundation. And the three major institutes at the NIH were NCCIH, NIA, the Aging Institute, and the Neurology Institute. And we, of course, we had collaborators in the Office of Behavioral and Social Science Research, as well as the Institute for Deafness and Communicative Disorders. And at NCCIH, I'm the lead for this effort. At the NIA, we have Corey Saint-Hilaire-Clark and Bob Finkelstein at NINDS. And our goal is to develop and pilot this toolkit for evidence-based intervention protocols. And so we divided this project into two phases. The first phase was really to develop the toolkit. And so we had those three workshops, as mentioned before. The process that we used was really, it wasn't a consensus process per se, but it was a process that allowed us to get input from individual researchers and from various disciplines. So we brought together panelists from 5 different areas: behavioral and social science intervention development, clinical trial methodology, music therapy or music medicine professional, neuroscientists, and also we had representation from patient advocacy group and also from art organization. We wanted to have a broad set of perspective so that we could have representation of the various communities. The way that we scheduled, that we had this workshop, was that prior to coming to the workshop, we had worked for a couple of months with the panelists on developing a set of questions that would be very relevant to the discussion, and also establishing how we were going to have guided conversation at the workshop. The deliverable for us is going to be this toolkit of common data element, meaning the building blocks that needs to be included for music-based intervention that will be required to be used in NIH-funded research project. And we also, because we were using brain disorders of aging as a model system, we are going to also provide a core data set of potential outcome measures and biomarkers that investigators could use in their specific studies. So we are currently at the stage of, responding to the comments from the reviewers from Lancet Neurology, and hopefully this paper should be, published in the summer of, 2022. The next phase will actually be pilot testing of the toolkit, meaning pilot testing of the principles that we highlighted in this toolkit. We are hoping for additional NIH funding announcement to solicit music-based intervention project that will utilize the toolkit. And the deliverable of part 2 of this project will be the refinement of the toolkit and the generation of rigorous preliminary data for pilot music intervention for brain disorders of aging. But, and we see this as the pilot data will serve as the basis for the generation of larger scale music-based efficacy and effectiveness trial for brain disorders of aging. One of the limitations that we have seen in the literature is that while a lot of interventions are being carried out, the sample size are very small and it's very hard to generalize. In addition, the quality of the reporting is less than desirable. So I think we are trying to improve on the rigor and reproducibility of that work. So what are the current challenges for music and health? From the work that we've seen, the application that we've received, the review panels that we've put together, we have identified a number of challenges that need to be addressed. The first one is really researchers, when they propose their studies, they don't really have a good research framework. So that's a critical piece, because without having this research framework, it's very hard to actually think of mechanism or the appropriate outcome measures and the biomarkers. So that is an area that needs further development. A lack of consistent terminology. So investigators talk of music therapy, music medicine, the type of music. Again, it's very, very fluid. It's very hard to actually provide a good interpretation of a lot of the work, because you don't exactly know what was done in those studies. Very important, the idea of interdisciplinary collaboration. So bringing neuroscientists together with behavioral intervention development and clinical trial methodologies, and obviously the musician and music therapist and music professional is critical in developing some research teams that can actually come up with a project and carry it through with a good understanding of those disciplines, and actually a true collaboration would be really important for the field. More mechanistic studies. We really don't have a good handle as to how music modulates a number of brain circuits and other physiological circuit as well. We don't have a good handle as to are there specific characteristics of music that should be emphasized. We still don't have a good handle as to differences between passive versus active engagement in music. Would really like to have additional animal model that would allow us to actually look at issues of various aspects of music, like pitch or rhythm or tone, and better understand how that what role that plays into the impact of music. I mentioned animal studies, and again, mechanistic measures and outcomes as well. So again, this is from the perspective of interventional studies, where we really need to have a better understanding of the target that we are after, what kind of measures, what kind of mechanistic measures, and what kind of clinical outcome would be related to that target. And finally, a lack of biomarker development. And this is work that, at the NIH, we are also going to pursue along with the FDA in the context of looking at biomarkers for behavioral intervention, which, music is definitely one of those interventions. So lots of work to do. This is a burgeoning field. We need to continue to grow that area because we see the potential in terms of impact on health. And that's the direction that we will continue to pursue at the NIH for now. And so our focus has been with music, And we probably will continue for a few years on that. We have decided not to broaden to other art forms for the time being, because music was the area where there was the most research. But at some point, in the maybe next 5 years or so, I can see us broadening to other art forms. So the next area is really capacity building and infrastructure. And this is the last piece in the set of recommendations that were highlighted in the Neuron paper. And in that context, I want to talk about some other initiatives that are actually enlarging the field and building a community that would allow for more research. And so the idea is building a community. It's really engaging interdisciplinary researchers to develop high quality, rigorous research in music and health, using strategies that would bring together the passion and the experience of musician and music professional with expertise in research methodology. And then the third piece is really cross-training of neuroscientists and music professionals in basic and clinical research on music and health. And this is happening right here at UCSF through the Sound Health Network. So this is really the mission of this network, which was funded by the National Endowment for the Arts. But this is a collaboration between UCSF, the NEA, the NIH, the Kennedy Center, and really the whole mission is to promote research and public awareness about the potential of impact of music on health and well-being. And so, I'm very pleased to have the opportunity to work with, the members of the Sound Health Network as they are providing a forum that would allow, this community to be built. And I hope that most of you are part of this network and take advantage of the resources that are being developed and provided by the network. Just want to bring your attention to the October 2022 Kennedy Center event. I think the planning is underway, so we don't have much details right now, but this is always a combination of performance and science, and it's the two previous events have been wonderful. Sorry about that. Another program that I want to highlight is in the same context of partnership and collaboration and bringing communities together, is a collaboration between One Mind and the Johns Hopkins School of Medicine. There is the Music and Brain think tank, which is really a group of a transdisciplinary group with expertise in research and practice. The focus of One Mind really has been to find innovative ways to address, mental health. And so they have an initiative called Aspire, which is, focused on finding new ways or enhancing current, practices into to solve many of the issues of mental health disorders in this country. So this effort is led by the International Arts Plus Mind Lab in the Brain Science Institute at Johns Hopkins. And it really draws upon various studies that actually shows that performing or listening to music can potentially be helpful for mental health. The focus has been on severe mental illness, and it's really an effort to expand and complement the Sound Health Initiative. So it's consolidating and advancing the evidence that's related to the role of music, not only in prevention, but also treatment of severe mental illness. Another large effort that is underway is the NeuroArt Blueprint. The NeuroArt Blueprint expands beyond music. It really looks at a number of art forms: visual art, dance, creative expression, a number, at least 7 different art forms. And this is, again, a collaboration between Johns Hopkins and the Aspen Institute, along with many other contributors. So what is NeuroArts? It's really an effort that brings together the art, the science, and the technology. And again, this is a transdisciplinary and extradisciplinary study of how the art and the aesthetic experience actually impact the brain and the body. And this was a 2-year effort. Oops. Uh-oh. I don't seem to be moving my slides. I don't know why I can't move that screen. Let me escape. Uh-oh.
Is the screen frozen?
It's frozen. Let me stop sharing. And then I'll share again.
Okay, thank you.
Hold on for a second.
Sure.
Okay. Okay. The wonders of technology. So this is a 2-year initiative that was designed to assemble the evidence that would make the case to have NeuroArt as an important contributor to health. And the report was released late in 2021. And we are currently at the point of taking some steps to implement the various recommendations of this report.
And Dr. Edwards, your slides are not appearing, if that is your intention.
Oh, sorry. I thought they were. Okay. It's still not showing?
No.
Okay, let me just, okay.
We're happy, of course, to continue without them if you like. Your decision. No trouble at all.
Okay, hold on for a second. Share screen. Okay. Can you see my slides now?
Yes.
Okay, all right. So let me just put them on view. I don't seem to be able to put them on slide on, but maybe that's fine. We're just gonna leave it like this.
Yes, that's
okay.
Fine.
The last effort that I'll mention is called the Epi Arts Lab. And this is housed at the Center for Arts in Medicine at the University of Florida. And it's a collaboration between the National Endowment of the Arts, the University College London, and 2 private organizations, the Bloomberg Philanthropy and the Steinmetz Foundation. Let's go. This is frozen again. Okay. So this is actually an effort that's looking at large-scale studies in large epidemiological studies in the US, looking at large data set to study the impact of the art, broadly speaking, on health. And Dr. Sankey and Dr. Daisy Fencott from England have been spearheading this effort. Now I want to bring this back to what we do at NCCIH. So all of those initiatives that I talked about really focus on partnership, collaboration between different organizations, different disciplines, to really bring together the potential of utilizing the arts on health. And this initiative really emphasized some current areas of interest at NCCIH. We are, like you, we're very interested in integrative health. And the new strategic plan at NCCIH that was released late in the summer of 2021 really advances the vision of whole person health and really better understanding of the interconnectedness of mind and body. So when we think about the umbrella of research that we cover, in the past few years, we had looked at those umbrella as to whether they fall under natural product or under mind and body practices. With our new strategic plan, we are actually thinking more in terms of the therapeutic input of some of those practices. So we actually, it's the same set of component, but we're categorizing in a different way. So we have approaches that are focused on the dietary input, psychological input, or physical input. And as you can see, there's a lot of interconnectedness between those inputs. So for example, since we're talking about music and art therapy and dance, you can see that for those particular areas, we have, there is a lot of interconnection between the psychological input and also the physical input. And that's important as one develops, let's say, an intervention, perhaps a multi-component intervention in the context of an art-based therapy. The other thing I wanted to bring to your attention is that in the context of whole person, we're actually looking at the continuum between health and disease. And we're looking at it at multiple levels. So we're looking at it from the physiological level, but also from the psychological and the social, level. And I think one more, level should be included, should be environmental, which we, this was probably an older version of that slide. So, but we really want to emphasize, when we are looking at health, we want to actually look at the whole person, not a single organ. And so whole person research for us really is, it's a framework that will empower individuals to improve their health in multiple connected domains, the physical domain, the psychological domain, and the social domain. And what we are really emphasizing is really to explore different methodology or different research paradigm that would allow us to study interconnected system. We want to also investigate multi-component intervention or therapeutic system, and also look at the impact of those interventions on multi-system or multi-organ outcome. And this is the goal. And we see that the work that I've been talking to you about, the music and health and art-based therapy, fits very nicely in whole person research. The thing I want to emphasize also is that we are not suggesting that the current medical system is obsolete. We want to really emphasize that we want this integration of conventional medicine with complementary and integrative health to work hand in hand in order for us to be able to get a better handle at this continuum between health and disease, and also allow us to have intervention point at which we can actually mitigate adverse effects. So let's see. I believe this was my last slide, and I would be happy to answer any question that you may have. So thank you for your attention.
Thank you so much, Dr. Edwards. Absolutely fascinating, such important work, and I think such a excellent exemplar of integrative research, including music and health, arts and science. I think really beautifully illustrates what NCCIH and the whole field of integrative health strives to do. So we do have several questions. So let me go ahead and get started with that. I'll start by asking one, and then I invite people to turn on video if you'd like to ask your questions.
I'm going to stop my share so that I can see people's faces.
Thank you.
Okay, perfect.
Terrific. So one of the questions has to do with the type of music and thinking of cultural settings. A couple of people asked about this, and it's certainly something that I think about as an anthropologist, given the importance of tradition and culture when it comes to music. It reminds me of studies of diet and nutrition and the importance of thinking about, I'll just use culture to shorthand now. Is this an area that people are considering?
Absolutely, but this is an area that we would like to encourage, because it's we definitely recognize that context and culture are very important. We have not seen that many applications there, but that is an area of great interest, and I think it's very important because the choice of the music is really important, and that, of course, culture would impact on that. So absolutely an area of interest, and would encourage investigators to pursue that area.
Mm-hmm. Thank you. Again, I invite people to turn on video if they have a question. Midya, I'm not sure if you do have a question. Okay, just participating appropriately. So there are several questions related to aging also. I want to invite Dr. Aronson to ask directly, or I am happy to as well. Pause here for a minute.
I can ask. So hi, Louise Aronson here. So I've worked with Julene Johnson and Teresa Allison, both of whom do work in this area. And so there's a lot of work with music and dementia in particular. And I suppose I have two sets of questions. One is, how do we get more attention? There's currently this drug that's $26,000 and of questionable benefit. And then we have music and other interventions that are less expensive and a proven benefit. And what are we doing about, following the science instead of that which is popular and, has more power?
So the way that I would answer that question is that we do have some work in that space where people have been doing intervention that show promise in the context of the therapeutic potential of music for dementia, especially in the context of mitigating some of the symptoms, the behavioral symptoms, However, many of those studies are, not large enough to allow us to have a definitive answer. And in the healthcare system that we have in the US, we really need some large-scale randomized trial to be able to make the case for, implementation of, a particular intervention. So I think we need to expand, some of the ongoing work, and that's what we're hoping that the toolkit would help us to do. If we actually have a set of guiding principles to help investigators develop, a good grounding for large-scale efficacy and effectiveness trial, that's the direction that we will need to go in, and we're gonna need that in order to be able to make that case to move the needle into a healthcare system. I don't know if I answered your question.
Yeah, no, that was great. We just need the funding to move the needle, you know, in the directions people need, and maybe not in the costly pharma directions always. And my other question was about narrative, which has had evidence over, you know, easily 25 years now for a variety of diseases, but never quite gets picked up. And part of my hesitation is always because of differences in language and literacy abilities. Sorry, I'm inarticulate this morning. You know, and I think it can be helpful.
You know, not too long ago, I was actually contacted by a group from the New York University that's actually, you know, doing at you know, expressive writing, narrative, and also theater. And it has, a lot of the work has been done in the context of mental health. So I think this is an area that definitely needs to be expanded. Again, we need a little more critical mass to move that field. And so it's a question, you know, just like music, it's a question of establishing a more standardized, I hate that word standardized, and I think most researchers hate that as well, but some way to actually have a little more consistency in the type of work that would allow maybe pulling of data or expanding the sample size to be able to make more definitive, you know, conclusions. Right now, it's too dispersed, and so we need to actually, you know, focus on that area a bit more.
Thank you.
And I think NeuroArts Blueprint will actually help with that, because that's one of the areas of interest there. And their role is really to be able to galvanize many funders to actually move that work forward.
Thank you. I am heartened by the fact that we have many questions. Unfortunately, we are also at the end of our time. I want to thank you. I think we will formally close now. And Dr. Edwards, if you're available for a couple of minutes, signal to me in some way.
Sure, I can say for a few minutes, but if there are many questions, I'd be happy to answer them by email.
Okay, so why don't we first make sure to take a moment to express gratitude. Thank you so much for joining us this morning, speaking about such an important topic and such an interesting burgeoning area. I want to give people an opportunity to get to any 9 o'clock meetings or clinics, but thank you so much again. We will pause for a moment, and I wanted to see if we can get in one or two more questions.